Hello, this is Dr. Mercola, and today I want to talk to you about diabetes. Why? Because you will be affected by it. How can I be so confident? Because I know that 1 out of every 3 people in the U.S. either has diabetes or pre-diabetes. So either you or someone you know or love will absolutely be affected by this disease. And the reason why it's so important is that it's absolutely, virtually 100% treatable. There is a virtual cure for this disease. And it really isn't a disease, it's just in almost every single person who has it, that is type 2 diabetes or non-insulin dependent diabetes, usually results from poor choices and choosing the wrong foods and not having enough exercise. So if you can stay away from breads, pasta, cereal, rice, potatoes, this will keep your insulin levels down and also your leptin levels, and it will also increase the sensitivity of your insulin and leptin receptors so that you need less insulin. So the reason I am making this video today is that I had a close personal relative pass away this week from diabetes. She was 74 years old. It was an aunt of mine, and I've known her my whole life, and here you can see a picture of her holding me, and we used to attend many holiday celebrations together, and I even consulted with her a number of times to encourage and sought to inspire her to adopt exercise to her lifestyle, but for whatever reason she just wasn't able to do that and eventually developed kidney failure and passed away this week. Now, many of my family members have diabetes. I've had other aunts and uncles, aunts specifically, die from diabetes, and my dad has diabetes, but he listens to me and he does between an hour and 2 hours of exercise every day and is a well-controlled diabetic and just about 80 years old now. So even if you don't have diabetes, which is a possibility, it is important to understand that you need to treat yourself like you are a diabetic, because the single most important physical component of aging is insulin. If you eat breads, pastas, rice, cereal, potatoes, you will invariably tend to raise your insulin levels. Now, if you don't have obesity, if you are a normal body weight, if you have a normal cholesterol, if you don't have diabetes or high blood pressure, then there's a real good chance that your insulin levels are normal. Now, you could actually measure your insulin levels. You could do a fasting blood insulin, and that level should be, at least in U.S. standards, about below 3, certainly below 5, and I like to keep mine about 2 or lower. So if you're anything higher than that, you've got a problem. So you can actually measure it, but normally if you don't have those illnesses, you can pretty much safely assume that there's a high likelihood you don't have elevated insulin levels or leptin levels. So, but if you have those, and that's 85% of the population, folks, 85%, then you really want to be careful with choosing those foods until those conditions are resolved. So I want to encourage you that to understand, to recognize that this is a completely treatable illness. With very simple measures, you can absolutely turn this around, because diabetes, at least type 2 diabetes, that is non-insulin dependent, type that typically occurs as a result of poor lifestyle choices, is virtually 100% curable without drugs and certainly without insulin. If you know any diabetic who is given insulin, please read the links on this page, and you will see that and start to understand the absolute absurdity of giving any type 2 diabetic insulin. It is absolutely going to accelerate their progression towards an early demise. So that is clearly something they need to avoid. So hopefully this bit of information will help you adopt a lifestyle that will help to normalize your insulin and your leptin levels, because unless you have those optimized, you are accelerating your course to an early death. And there's just no reason for it. Each and every one of us can and should live well beyond 100 years old in great health, with complete control of all of our functions and our mind and the use of our joints and mobility. So This is what we're designed to do. But if you make these choices and choose processed foods and convenience foods and have elevated insulin levels, there's just no way you're going to escape the ravages of elevated insulin and leptin levels. So hopefully this will inspire you so that you can start to take control of your health.